How do hospital checklists help prevent personal injury surgical errors? Imagine a busy operating room where every second counts, and a small mistake could lead to serious injury. That's where hospital checklists come into play, acting like a safety net for patients. These checklists are detailed tools used before, during, and after surgery to make sure all critical safety steps are followed. They help prevent common surgical errors like operating on the wrong site, leaving foreign objects inside the patient, or making anesthesia mistakes. The process starts with verifying the patient's identity, confirming the correct surgical site, and ensuring the planned procedure is accurate. This step is essential because mix-ups can happen, especially in busy hospitals. The checklist also confirms that all necessary equipment is functioning properly and that the right supplies are available. For example, if a surgeon needs a specific size of implant or special instruments, the checklist makes sure they are ready and accessible. Before the patient leaves the operating room, the checklist ensures all surgical instruments and materials are accounted for. It also verifies that tissue samples are labeled correctly and that no foreign objects, like sponges or tools, are left inside the patient. This systematic approach directly targets the causes of many surgical errors that can lead to injury claims. From a legal point of view, these checklists serve as proof that hospitals and surgical teams took reasonable steps to protect the patient. When a checklist is properly used and documented, it shows the hospital followed accepted safety standards. This can be a key piece of evidence if a personal injury claim arises due to a surgical mistake. If the checklist was ignored or not properly followed, it might be seen as neglect, increasing the hospital's liability. Checklists also promote open communication among the surgical team. Surgeons, anesthesiologists, nurses, and technicians are encouraged to speak up if they notice any issues or potential risks. This teamwork helps catch mistakes early and prevents complications. Studies show that using safety checklists can reduce surgical deaths and complications by nearly half. The effectiveness depends on consistent use, without rushing or skipping steps. In legal cases involving surgical errors, having a record of checklist use can be a strong defense. It shows that the team adhered to safety protocols, which supports the hospital's claim of providing standard care. Conversely, if a checklist was not used or was ignored, it can strengthen the case for negligence. In the end, hospital checklists are more than just paperwork. They are vital tools that help prevent personal injuries caused by surgical errors. They ensure safety steps are followed, improve communication, and provide documented proof of care. Proper use of these checklists can make a big difference in reducing mistakes and protecting both patients and healthcare providers from avoidable injury claims.